housing opportunities for coordinated entry. And when I sent out the invitation, I asked that you go ahead and share this link with any of your staff who are involved in the CE process. So I'm seeing some names I don't recognize, so I just want to acknowledge that and say hi to everybody. And we'll get this started.
And thanks, Liz. We'll do quick introductions of the IHCDA HCV staff that are here today. My name is Jeff Sangalowitz. I'm the Director of Housing Choice Programs. And really, the point of this presentation today is to go over all of our housing choice programs, rental assistance options that we offer. We know that most of the partners on the COC side are pretty familiar with what our community services team are doing, but may only know bits and pieces of what we are doing on the voucher side. So we wanted to make sure that everyone was aware of the various housing options that we have for folks, not just ones that are specific to homelessness, but also our general HCV vouchers, and our other special programs that may have slightly different target populations, but folks who you're serving may still be able to benefit from. So that is me. That's kind of the agenda for today, or the objective today. And Liz, if you want to introduce yourself and then pass it on to Danny.
Yep. I am Liz Shunn, and I am the Emergency Housing Voucher and Landlord Engagement Analyst. And I will have an update at the end of this presentation on where we are with emergency housing vouchers. And I'll go ahead and pass it to you, Danny.
Danny, you're muted.
Hi, I'm Danny. I'm the Portability Analyst for IHCDA. I'm going to be discussing some of the options for portability, stressing some of the things as far as our clients porting out, things like that. Yeah, that's about it. Liz, you're muted now.
Sorry, my husband is also in a meeting, so I'm trying to mute myself when I'm not talking. So I just gathered some of the acronyms that I know that we use without thinking. You're probably already familiar with most of them. Some of them we won't even use at all today, but I just wanted to put that out there for everybody. And coordinated entry. I would say that most of you probably have a fair idea of what coordinated entry is. And depending on how long you've been in the field, you may know what it was like before, when a person who was experiencing homelessness had to go to each individual site in order to try to get assistance. And with coordinated entry, they've centralized that, and everybody's connected now, and we're using the same assessments. And I did link the policy brief in there for anybody who isn't familiar, and you'll get the presentation and you'll get all of the links that are in there. So the balance of state, this hasn't changed in a while, correct, Jeff?
No, it has not.
Okay, we just got the update for the LSA map, so I just wanted to, I didn't know how long this had been. So this is the map, these are the regions, and some don't have any PHAs, some have multiple, and that's just the way things are divided up through the state currently. And you'll be able to access those links if you need to. If you have any updates for your region, I know that Region 1A recently had some changes that we haven't gotten. The second link here has the CE listing by region. So if there's any information on there that needs updated, please send me an email at eschunn@ihcda.in.gov, and we'll get that corrected and updated. It was updated in August of last year, but there's still been some changes there. And that's you, Jeff.
All right, thanks, Liz. So I'm going to go over kind of a brief overview of our entire HCV program and the various voucher types that we have and how they can be accessed, so that, you know, perhaps if you're working with someone that may not be eligible for a COC or PSH unit, but they still need resources, you can refer them to one of our many other programs that they may be eligible for. If you want to go ahead and go to the next slide, Liz. Thanks. All right, so specifically with homelessness, we have implemented several policies to try to kind of fast track referrals from the COCCE list to our vouchers. One of those ways is that we do directly put project-based voucher subsidy into PSH projects that are developed through the Indiana Permanent Supportive Housing Institute. So to this point, we have about 600 units of PSH that have project-based voucher rental assistance. You or your organization might have some of those. And those projects all accept referrals from the local coordinated entry list in their region based on their individual tenant selection plan. So some of them may be veteran specific or youth specific or non-elderly disabled, et cetera. They may have a specific target population, but they are all accepting referrals from their local coordinated entry list when they have a vacancy. The second way in which we allow referrals from COC organizations in the CE list is that we have about 3 years ago now, we implemented a limited preference for up to 100 referrals a year from coordinated entry. I'll get into that criteria on the next slide. And then also 50 referrals from PSH projects receiving COC rental assistance, kind of a moving on preference for up to 50 folks a year. And then additionally, last July, as I'm sure most of you are aware, we were allocated 338 emergency housing vouchers, which are accessible through referrals from coordinated entry. Thanks. All right, so our two limited preferences, as I mentioned, the first is for referrals coming off of the coordinated entry system. Obviously, the EHV program has made this a little bit of a moot point right now, as those referrals will instead receive EHV vouchers, since those include more services, service funding, and housing search assistance. But, you know, once those EHV vouchers are fully utilized, you'll still be able to make a referral to our general HCV pool through this limited preference. And it's the same referral packet that is used for EHV. If you have any specific questions when that time comes up, feel free to reach out to Liz or myself and we can work with you. And then the other preference that is probably useful right now for some of you is our 50 referrals a year that we'll accept from COC supportive housing. So the goal of this was to mimic what is being done in our PBV PSH units. Within the project-based voucher program, we are required to allow a person to receive a tenant-based voucher after they have been residing in a unit for 1 year. We do still work with them and the service provider to make sure that they'll be successful in that if that's what they decide to do. Make sure that they are in a position where they've, you know, engaged in services and are ready to perhaps move out of that permanent supportive housing and move on. So it's the same thing for the COC units, and if you can actually go to the next slide, Liz. If you can go to the next slide, and I'll jump back to this one, Liz. All right, so for the COC units, similar to our PBV units, the individual must have been living there for 1 year. And then the two requirements for all HCV programs across the country, these are the two mandatory reasons that someone cannot be admitted, regardless of public housing authority or special voucher type. They cannot have a household member subject to the lifetime sex offender registration requirement in any state. And you can check that through the Drew Sorgen website, and we can provide that information to you if you're not familiar with that website. However, if they do have a household member, they will be given the option to remove just that one individual for the household. And as long as there's no one else in the household that is subject to the lifetime registration requirement, they could still be eligible if they remove that one individual. And then second, mandatory reason for denial is if they've ever been convicted of production of methamphetamine on premises of federally assisted housing, which could be when they were receiving Section 8, or it could be in a Section 42 property, tax credit property, etc. And same thing there, if it's a multiple member household and it's just one of those that has that mandatory denial reason, they would be offered the option to remove them from the household. All right, if you can go back a slide, actually, Liz. Thanks. All right, so for the CE limited preference, similar to EHV, the criteria is that they be the first eligible household on their local CE list. So as ordered by VISPDAT, and then the eligibility criteria is the same as the other preference that I just mentioned. All right, Liz, a couple slides forward. Thanks. All right, so for the referral process, for the coordinated entry limited preference, it would be to identify that first eligible household on your local CE list, verify that no household member is subject to lifetime sex offender registration, and that is the link to the jury surgeon database that you can check, and then work with the household to collect the signatures and in filling out the required paperwork. If you've done an EHV referral, it's that same paperwork, that tenant information form that asks about income, household members, social security numbers, etc., all that normal stuff that you need for government assistance. And then additionally, make copies or work with the household to obtain and order birth certificates and social security cards, as well as a photo ID for any adult household members. And in general, across all of our voucher programs, if the household that's applying is doesn't have those things, but they can demonstrate that they are working to order those things either through letters from the Social Security Administration or receipts if they've already made the purchase and they're just waiting for them to arrive, we can waive those requirements and just follow back up with them once they've received those documents. Particularly with the birth certificates, we know it can take a bit longer if they have to work with the health department in another state. And then also, if any member requires reasonable accommodation, so that could be that they need um, an extra bedroom or an increased payment standard, that we would just need to request documentation for that reasonable accommodation request. And if you are working with a household that requires that, reach out to us and we'd be happy to help you understand that process and what needs to be submitted to justify it. The main thing is just that there needs to be a nexus between their disability and what the reasonable accommodation that they're requesting is, and we can help you with how to document that when you're making the request. And then for these referrals, any referrals can be sent directly to me via my email there or to our fax number. Thanks. All right, so once we receive the referral, and this is the same for both the moving on and the CE referral, we'll work to assign a local caseworker. So as Liz mentioned, our jurisdiction is any public housing authority that or any area of the state that is not covered by another public housing authority. So in all those areas, we work with local, usually CAP agencies to administer the vouchers and have local caseworkers there who have those relationships with landlords and are in the community, and also have information about what other services their CAP agency might offer that could assist a applicant. So once we receive a referral, we'll assign a local caseworker in the area where the household wishes to lease up. And that caseworker will reach out to schedule a briefing, and they'll either contact the family directly, or if that family is working with an advocate or has identified an alternative contact, they'll reach out to them. Once they've scheduled the briefing and the briefing has taken place, they'll issue a voucher. Our local caseworker will provide some assistance in conducting the housing search. I think like any kind of advocate, some of them have a lot of resources. They've been doing this for years. They know landlords and they can really provide a lot of assistance in that housing search, but also it's a position that does have some turnover. So some of them are newer and just don't have as much experience and haven't built those relationships with landlords. So it's a little bit luck of the draw if you're moving to an area where you have one of those caseworkers that has been around for years. They may have a lot of landlord contacts that they can reach out to and help you with your housing search. Whereas if you're moving to an area where perhaps it's a newer caseworker, they may not be able to provide as much assistance just because they haven't developed those relationships yet. So once a housing is identified and an application has been approved by the landlord, they'll schedule an inspection. That's an HQS inspection to verify that the housing meets minimal health and safety requirements. And then once it passes inspection, immediately the household can execute a lease and move in. And that is kind of the process for all of our voucher programs, whether they're coming off from a referral or off a wait list, like the traditional voucher program. All right, so after referral, it's kind of the same for moving on, but prior to referral, when that referral is being made, we do require that the household must have resided in their current unit for at least 1 year. So obviously when a household is moving into a COC supportive housing unit, they will typically sign a 1-year lease. We want to make sure that that first year of the lease has been completed and they're at a point in their tenancy where they are ready to move on from supportive housing. Additionally, the referring organization, so that could either be the service provider at the COC site or the property management, must commit, or typically the COC grantee, must commit to not identifying new households for the unit until new housing is identified for the household being referred. So we see this a lot in our PVV, permanent supportive housing projects, where an individual will decide that they want to move on from the project and submit a notice to vacate as they look to port out their voucher and move in to a new unit on a tenant-based voucher. But once they start that housing search, they realize that the timeline perhaps that they originally thought it would take place on is going to take a bit longer, and they're not going to be ready to move out of their unit as soon as they thought because they're having difficulty finding a new landlord that will accept them. So we just ask that if you are referring someone for a moving on voucher, that you commit to not identifying a new household for that unit until after they've, I had an actual move-in date set with their new property and know when they're going to be vacating. Additionally, the referring organization, so typically the organization that's providing services to the individual must commit to assisting the household in their housing search, and then they also must certify that the household can remain in their current unit for as long as it takes to identify new housing. So kind of going with that second point there. Additionally, currently, right now, this is limited to PSH COC units. We are looking at the possibility, knowing that we're not going to be needing the normal coordinated entry referrals as long as we have EHV vouchers available, of expanding this also to rapid rehousing households. So the limits on these particular vouchers, the coordinated entry referrals, it says 50 there. It should be 100 referrals each year. There's no regional limits. It's just first come, first serve. And then same thing with the moving on referrals. It's 50 a year, and then no limits on referrals from each property, and their first come, first serve. And we will, IHCDA, unless we have posted a red notice on our website notifying that referrals are closed, we are always accepting referrals. And when they are closed, they'll be closed for that calendar year, and then we'll open up again on January 1st of the following year. All right. So a few other IHCDA programs that are not as connected directly to COC or coordinated entry referrals. I think most folks are probably familiar with the VASH program. We do have VASH awards with the Indianapolis VA, so that covers central Indiana and some other parts, kind of reaches out into some other areas of the state. We have 5 vouchers with the Cincy VA, which just covers a few counties down by Cincy. And then we also have a voucher award with the Northern VA systems, so Fort Wayne, South Bend, Anderson areas. And also we have recently opened up a property in Lake County that is 75 project-based VASH vouchers, and those referrals come from the Chicago VA. If you do have a household who's a veteran and they may be eligible, they should be referred to the the homeless veterans hotline, which is 877-48-VET, and they can do an assessment to determine if they may be eligible for VASH. Currently, you do need to be VA healthcare eligible to be eligible for VASH, although they are, legislation was passed last year that opens that eligibility up to non-VA healthcare veterans, but as long as they were not dishonorably discharged. But that implementation of that expanded eligibility is still ongoing, and the VA is working on rolling that out. Additional voucher program is our non-elderly disabled vouchers. So this is for households between the ages of 18 and 62 who have at least one member who is non-elderly and disabled. We do occasionally open this wait list. Currently, it is closed except for referrals for households that are residing in an institutional setting but could be live independently with rental assistance. So typically that could be a state psychiatric hospital or any kind of institutional setting. It could even be if someone is exiting prison, they would be eligible to have a referral made for them, and that could come typically from the institution that they're currently residing in. And that referral must be made by a knowledgeable professional. So it could be a doctor or someone in that setting that they are residing in. If we do open this wait list to the general public that meet the eligibility criteria, that would be posted on our website as a public notice, and that's true of all of our waitlist openings. And yeah, like it says there, if you have an individual who may meet this eligibility, just reach out to me and I can go through that referral process with you. And then our general voucher pool, we maintain a wait list for the general public in each county in our jurisdiction. So we have bits or pieces or entireties of, I think, 82 counties, 83 counties. So each county has a separate wait list, and those waitlist openings are announced via public notice on our website. If you have not already done so, you can sign up for email alerts when those public notices are posted. I can put that link in the chat in a little bit here. And each time a county waitlist is opened, we do issue a public notice, and if you're signed up for those alerts, you will be you'll receive that, and the application is online as well. So you do not need to actually, physically go to an office to apply. There's an online application. Additionally, while we have a separate waitlist for each county, anyone can apply for any county's waitlist, and if they are selected, they can live in any part of our jurisdiction. So, they may apply to White County if they're selected and they wish to live in Lake County, a part of Lake County that's within our jurisdiction. They could lease up there, even though they originally applied for the White County waitlist. And then our most recent special program voucher, not counting EHV, is our Family Unification Program. This is for DCS involved families whose main barrier to staying together is stable housing, or for foster youth aging out and at risk of homelessness. And for this program, referrals are made by DCS. So if you do have a household on your local CE list, or just a household that you're working with that you think fits that definition, encourage them to reach out to their DCS caseworker, and that DCS caseworker can work with them to see if they're eligible and if they meet DCS's prioritization requirements for referral. All right, so I think we'll probably have some question time at the end as well, but if you do have any questions about any of these programs, feel free to reach out to me directly at my email listed there. Right, and then I'll pass it off to Danny to go over some of our portability things.
All right, thanks, Jeff. So again, I'm Danny Monham, the HCO Portability Analyst for IHCDA. Liz, if you could push that forward. Thank you. So, quick definition of portability is defined by HUD. Portability refers to the process through which a family can transfer or port their rental subsidy as they move for blah, 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 blah. You can read that. What it really means is that under the Housing Choice Voucher Program, a family can basically take their voucher with them anywhere within all 50 states, Puerto Rico, and I think some other weird principalities and things like that as well. Yeah, is basically how portability works. Means that they can take their voucher with them should they choose to move outside of our jurisdiction into any other jurisdiction. Liz, if you can move that forward. Thank you. So, under most programs, clients are eligible to port after 1 year of occupancy within their initial jurisdiction. We can always look at reasonable accommodations based on healthcare needs, other things to waive that 1 year requirement. One of the things that is required is they do need to be in good standing with their current housing authority. So, if they owe debts or anything like that, we cannot port them until they are resolved. Um, is one of the big things there.
And just to add to that, Danny, resolved could mean that the debt's paid, but it could also mean that they've entered into a repayment agreement and are in
Correct.
good standing on the repayment agreement.
Right. As long as that repayment agreement, as long as they're not in a poor standing with that housing authority, we can usually move forward with it. All right, so I'm not going to get into the extreme details as far as the process goes because there's a limit. Most of it's on our end here, between us and the receiving housing authority. But as far as the process moves forward, basically the client just figures out where they would like to go, what housing authority they're going to, city, state, county. Everything's different for each housing authority. They're going to complete a request for portability form with their current housing authority. Um, that housing authority is basically going to determine whether they're eligible to port from there. They're going to send me the portability packet with all their paperwork. Usually includes, all the forms that we need, social security cards, birth certificates, incomes, IDs, all that kind of stuff. They're going to send it to that S8 portability at ihcda.in.gov. Email comes right to me. I'm going to take a look at that packet, make sure I have what I need. Then I'm going to contact that receiving housing authority to make sure that, they're currently accepting portability, whether they're billing, whether they're absorbing what they're doing there. And then basically I will send everything over to that housing authority. At that point, it's pretty much out of our hands. That other housing authority that they're moving to is going to get in touch with the client as far as scheduling a briefing, issuing the voucher. They're going to verify, um, all the income, assets, all those verifications. They're going to get in touch with them regarding that. So once it leaves IHCDA jurisdiction, it really comes down to that other housing authority, um, contacting that client and scheduling everything on that end there. Liz, if you can move forward, thank you much. So one of the biggest things that we're encountering now with the advent of the emergency housing vouchers is anybody under that EHV is eligible to port immediately. They can basically bypass that 1 year or 12 calendar month waiting period to port out, and that receiving housing authority cannot refuse that port if it is an EHV port. However, and I stress this because this is something we're coming up against a lot with right now, is if that receiving housing authority does not have an EHV program, and it is possible, I don't know if Liz has posted this in there or not. If you go to HUD's website, you can go to HUD, or if you just even Google HUD EHV dashboard, it will display what housing authorities are currently administering an EHV program. But if they do not administer that program, they may choose to administer or absorb. They can either bill us for administrative fees, or they can choose to absorb that family under their regular housing choice voucher program. And what we've been coming across a lot lately is that they are choosing to absorb under their HCV program. And if that is the case, the family can be subject to all the provisions of the housing choice program. One of the big things with that EHV program is it overlooks a lot of criminal background and things like that. Under HCV, they may not qualify anymore because of that. Um, so the family may, if they don't administer that, they may be rejected by the housing authority saying, hey, we have to observe them as HCV. However, we can't because of, whatever circumstances going on with that because of that guideline. Um, And then after the fact, once they do absorb that family under that HCV, that client is no longer an EHV participant. They also do no longer have access to any of the additional funding and services that are applied to those EHV participants. Let's go and move forward.
That's all I have for you, but I was just gonna, since we started working on this presentation, Jeff and I have been working on some, oh, I lost the word.
MOUs.
MOUs, yes. To kind of take care of that gap. So when a PHA is not administering and they but they aren't absorbing either, then in some of those cases, we're trying to get MOUs so that we can administer those EHVs directly for clients who need those additional services. So,
Yeah, and for the audience today, I would say if you are familiar with the local housing authority in your jurisdiction that perhaps is a little bit higher barrier and does not have EHV allocated to them, let us know and we can work on getting an MOU with them specific to EHV that will allow us to administer those vouchers directly in their jurisdiction under our own eligibility criteria. It's useful in that allows us to use some of our services funding to help them with their housing search, and also allows them to stay eligible for the program. The couple of factors that we are looking at when entering into those MOUs, one, we need to make sure that we have the capacity to administer the vouchers in that local area. So we're reaching out to our partners that are already working in those areas. So for example, in Columbus, Housing Services is our LSA that administers HCV for us there. They acknowledge that they'd be willing to administer them within Columbus as well. So we proceeded with working with Columbus on getting an MOU executed for EHV, but we do need to make sure that we have our local partner there has the capacity to take that on in addition to their normal jurisdiction for the EHV vouchers.
okay. So the next part I have is things to consider. And these are things that have come up while we've been trying, or I've been trying to administer the EHV program. So the EHV program was rolled out back in July, and I wasn't hired until October. So I spent a lot of time trying to figure out what information had already gone out and what hadn't, and trying to find those barriers to services. So this is just kind of some things that have come up that we haven't really already talked about. Um, so I fair housing is on here because there's something that the HCV program, if you look up steering when it comes to real estate, there is a long history of discrimination. And as HCV, we not only can we not tell people where they can and can't live, but we have to strive to provide opportunities for them in those higher opportunity areas. So steering when it comes to HCV and fair housing is making sure that we are not limiting our clients' housing search to places that we know are more friendly to the hard to house. And I know this happens all the time. If you're working with veterans and other hard to house populations, and you know that these are the places that accept those clients. But as far as the housing agencies are concerned, we can't do that. And on top of that, one of the things that just it doesn't necessarily imply anything inappropriate is going on, but within our system, we have agencies who are making the referrals and who own the properties that that people are being referred to. So we know that that happens, but we just need to make sure that um, as from an outsider's perspective, that we are making sure that that this isn't a pipeline for particular agencies to do that, that we are giving our clients the opportunities and showing them all of their options, just to make sure that we're staying within fair housing guidelines. Jeff, did you have something you wanted to add?
I'll just add to that, if you as an organization have properties that you lease out, it's absolutely 100% fine to make sure that EHV participants are aware of those, even after you're the agency that also refers them. And you can even explain, some of the benefits of leasing there might be that the application process might be faster, there's lower screening criteria, but they need to understand that that's not their only option, that if they want to, they can look for private housing around the community. So, we just want to make sure that it's not being presented to them as this referrals into the housing that you all already own. And we haven't seen that, but we just need to be sensitive to that due to just fair housing regulations.
Okay. And then one of the other things we've talked some about the barriers to issuing the EHV vouchers with the coordinated entry, and it varies by region. But a lot of what I was hearing in the beginning was individuals and agencies reporting that they weren't getting responses from CEs. People don't know what the program is, and I feel like I'm not getting that quite as much since we've started working on these trainings. But I just wanted to make sure that that we're still talking about it. The other side of this slide has some links. There's a link to the VI-SPDAT, and there's um, some studies about the racial disparities and disparities for survivors of domestic violence within the VI-SPDAT. And I know as a group, coordinated entry is talking about what will replace the VI-SPDAT at some point. But I just wanted to leave these references here for you. And the bottom one under survivors of domestic violence is it is a podcast. If you don't want to read the studies, it's an enjoyable podcast, and it is done by one of the people who did the study. So there's a lot of good information in there if you're interested. And then your EHV update. I think we talked about the eligibility. So I'm just going to talk about this in relationship to the other programs that you just heard about. The things that are different about EHV, for the most part, other than just being low barrier when it comes to criminal background, because we only have the 2 mandatory restrictions. We have incentives for landlords. So this is for our jurisdiction. And Jeff, if we have an MOU with a PHA, does this landlord incentive, is that included in that, or do you know?
Yeah, if we have an MOU and we're directly administering it in their
Okay.
jurisdiction, it will be as if the participant was in our own jurisdiction.
Okay, I thought so, but I couldn't remember if we talked about that or not. And then the other eligible expenses. So we can reimburse for application fees, security deposits, utility deposits, because clients have to have the utilities in their name. If they have arrears, we can also reimburse for that. And so those are the things when we're talking about portability, that if there is a PHA and they're absorbing and they don't get those additional benefits, these are some of the additional benefits that they're missing out on.
And I'll add to that, that list is not exhaustive. We have the flexibility to kind of address any barriers that they may be experiencing in their housing search within our discretion. So if there's something unique to the household that they need a little bit of assistance to financial assistance to overcome a barrier, let us know and we can figure out if that might be eligible or not. There is kind of a, other expenses that are contributing to barriers to housing categories. So there may be items beyond this list that are eligible for assistance.
And then if you attended the last CE committee meeting, this sheet is, or this slide is the same. I have gotten 4 new referrals, but I haven't updated them as to where they're coming from. So currently this is what we have. So we would be up to 45 and still with 7 housed. And I'm still getting most of the referrals from the same few regions, but I have picked up a couple regions that had not made referrals before. So we are making some progress in that department. And there's our last slide there. And I think most of these you guys are already aware of and have access to. I just added the housing choice opportunities page so that you can see probably most of the things that we talked about. It's just spread out a little bit more. So I am going to end this and open it up for questions. If anybody has anything, just let us know.
You can feel free to unmute yourself or use the chat for any questions.
Danny, staring at them ominously is not going to get people to ask questions.
You never know.
Well, I can fill some time in. Thanks everyone for joining. I hope you found this helpful. I know we did this something similar a few years ago at Development Days, and I'd like to start doing this at least annually, just making sure that with the COC organizations having turnover, folks are aware of all their housing options, not necessarily just specific to homelessness. If you do have a local PHA that you work closely with and you are curious about some of their policies or making connections there, feel free to reach out to us. We do, through Portability, work a lot with other PHAs around the state. So if you have a local PHA in your region that you haven't had that connection with in the past, feel free to reach out to us and we'd be happy to try to make a connection if they're a partner that we've worked with closely with, or if not. We certainly understand that PHAs have a lot of resources available to them that can be very helpful in getting folks housed, and we want to make sure that you all are connected to your local PHAs as well as us so that we can utilize those resources for the populations you're serving.
Looks like there's a comment there. I think this one's for you, Jeff.
Yep. Yeah, Jen, obviously, we don't have or authority over any local PHAs. So if Lafayette isn't interested in a moving on voucher, there's not a ton we can do, but you can also use our moving on preference and we can, if the individual, we can waive the 1-year portability requirement if there's a reasonable accommodation request to do so. So if, that typically would look like, perhaps the household is receiving some services directly in that community and they need to remain close to those services. You could refer them to our moving on preference, and if they have that reasonable accommodation request, we can waive the 1-year portability and directly port them to the local housing authority. The same disclaimer that applies to THV applies there, that if for some reason, criminal background check, they couldn't pass the local housing authority's jurisdiction, they could deny them. But that is kind of a backdoor into another housing authority's jurisdiction. If they meet our moving on criteria, they can be referred to us and we can port them to that housing authority if they have a reasonable accommodation demonstrating that there's a need for them to live in that community to receive services, or perhaps they have a child in school there.
Hey, Jeff, I have a question.
Yes.
Mike Keevan with Aspire, Indiana. So the non-elderly disabled voucher,
Mm-hmm.
leaving an institution, you mentioned state hospital or maybe jail. What
Mm-hmm.
about a substance use treatment
Yeah,
facility?
so any institutional setting, there is a HUD definition of institutional setting that I could pull for you, but that would definitely qualify. Mm-hmm. Mm-hmm. And it has to be, the main criteria is that they could live independently if they just had that stable housing component.
Okay, thank you.
I just wanted to add, if you are here because someone else has shared the link with you for this session, go ahead and put your email address in the chat box if you're interested in future trainings.
Yeah, Jen, I will post the link of our jurisdiction in the chat, and that link also includes all the housing authorities in the state. It's a map of our jurisdiction along with the local PHAs where we do not have jurisdiction. And on that map, any county that is in color is in IHC's jurisdiction. The different colors are for the different CAB agencies that we work with in those areas. I'll also add that if you're working with like a specific client and you're just trying to figure out what housing options might be available for them, feel free to reach out to me or Liz, and we're happy to talk through what options there are on the HCV side, whether that's through your local housing authority, just kind of where to get started based on the specifics of that participant or that client. We're happy to talk through what their different resources might be. We didn't get into it at all today because it's not directly under HCV, but there are a lot of project-based, just rental assistance properties around the state too. So some of those projects are Section 42 elderly projects, there's PBCA projects, there's just several different communities that receive, that are affordable properties, and we can help with that application or refer to someone else at IHCDA that can help with that too if you're just got a participant, you're just really trying to find a housing option for them, we're happy to help you in that. Liz, do we have a HV Q&A scheduled to remind folks on, or have we not scheduled the next one?
I believe we've scheduled the next one for the 1st, but I am double checking.
Okay.
Yep. We have one scheduled for the 1st at 3 o'clock.
Great.
And that invitation went out to everybody that got the direct invitation to this meeting. So again, if you got this link from someone else, you want to make sure that you put your email address in the chat if you want the invitation for that EHV. Wait a minute.
And yes, Jen, this recording will be uploaded to YouTube, and we can send that link up in our follow-up email.
Oh, okay. Hold on. I have 2 things listed with a very similar title. So our next Q&A is scheduled for the 2nd at 2 o'clock.
Okay.
The one on the 1st at 3 o'clock is the one that HUD does. So.
Yeah. And that is our EHV program Q&A. It's kind of office hours, but feel free to jump in if you have any questions about HEV programs in general. And the format of that is typically kind of a 15-minute quick update on the HV program, where we're at with referrals, and then open question and answer.
I'm really sorry if this has been answered already. This is Mary Bales, Oakland, Region 2. So I'm trying to understand this process for CE. I might have sent an email about it already, but if there's counties in Region 2 that don't have people that are entering people into the CE list, would that, like, can we travel out of county to, like, how does that work? I don't know how to ask this really even. To get people in other counties onto the CE list that there's not really anybody in that county yet who does that. What would be the best process for that to make them eligible for?
So you're referring to those counties that Oakland doesn't directly provide services to in Region 2?
Right.
Yeah. Yeah, you can, and this is really more of a question for our community services team than us, but my understanding is you can enter anyone into coordinated entry as long as they're within Region 2 and do that via ISPDAT yourself. But obviously that may not be sustainable for your organization, if that's not your typical service jurisdiction. But I can have Kristen and her team provide some guidance on that too.
Okay, awesome. Thank you.
All right, well, not seeing any more questions, so I think we'll wrap up. Liz, if you want to put the slide with our contact information up again real quick so people can take note of that if they haven't already. And yeah, feel free to reach out to any of us if you have any questions. And if we're not, any questions about housing really at all, and if we're not the right person for it, we'll try to get you to someone at IHCDA who can help you. And hope to hear from all of you eventually, and keep building these partnerships and working to get folks housed.
Our contact information. So those are the resources. I think the only email address we put up there was yours.
Oh, okay.
But you can always reach me at eShun or at the EHV email address.
All right, thanks everyone. And Liz will be sending up a follow-up email with the link to the recording probably tomorrow to give our marketing team to get time to get that uploaded, and then also just some other resources that were mentioned today.
Thank you guys.